and Union County with our partners. I'm going to introduce them in a few moments, but Assemblyman Joe Crine from the state of New Jersey is here, and I thank Joe for coming out. And a freeholder from Union County, freeholder Sergio Granados is here, and I thank him as well. And I want to thank, first of all, Union County College for making this room available, and I see Dr. Stephen Naco up there. Thank you, Stephen, for making this available, and thank you for the students for coming out, because we need your help in spreading the word about healthcare and the availability of healthcare. And I'd like to say that I've been the mayor for 21 years, and I usually don't say that a lot, but for every week that I've been the mayor, I can say that I've usually received at least one phone call on how do I get health care, whether it be for a family member, whether it be for someone who's lost their job, whether it be for some ongoing condition that an insurance company was going to drop them. And my options and advice were extremely limited over those years. And now with the Affordable Care Act, we have the ability as elected officials to make sure the residents of our community have the opportunity to get health care. And we've done some things here in the city of Elizabeth in order to put that into effect. No matter what's going on in Washington, no matter what you read about in Washington, the Affordable Care Act is going nowhere. It started on October 1st. There's going to be open enrollment until March 30th of 2014. And the city of Elizabeth is going to be a partner in implementing this health care act. The governor is not supportive of this act. The governor has done everything he can to make sure New Jerseyans are not aware of what's going on. So therefore, it's going to rely on mayors, members of the Assembly and the Senate, freeholders, in order to get the word out there that the Affordable Health Care Act can help you not only as an individual, but as a family. It's been referred to the Affordable Health Care Act and ObamaCare. It's given the ability to have affordable quality health insurance and to reduce the growth of healthcare spending in the United States. The status of all of our healthcare insurance is not going to be the same, and many are still trying to decipher exactly what all of this means. I'm here to say that the City of Elizabeth is going to have trained professionals that are going to be available to help you. We're going to be available on appointments. We're going to be available at the library, and you'll hear from the library director in a few minutes. And we started with an auto call to all of the residents of the City of Elizabeth last Tuesday on the opening day, and the next day, the very next day, we had hundreds of people either coming to the library, going to the Stephen Sampson Center, or calling our number and asking how they can get further information. Municipal staff members, along with counselors that are currently in the process of being certified, will be available by appointment to explore options. Our team is going to be available to provide constituents with information on new benefits, rights, and protections, as well as what the plan includes. Our new library director has offered the use of the library computers to any resident who wishes to sign themselves up for the ObamaCare under www.healthcare.gov. We have a number, 820-4045, that if you would like information or counseling, you can call that. You can also call the healthcare.gov or call a 1-800 number, 318-2596. It goes from October 1st to March 31st of 2014. Young people are extremely important. I lecture at King University. And if you are less than 26 years of age, under this plan, you can stay on your parents' health care policy until you're 26. You have more options. You can no longer be denied coverage if you have a pre-existing condition. You will have the ability to get health care effective January 1st if you take the time to go through the process. And it could be cumbersome. And this is the government that has put this together. And there's a whole host of people out there who don't want people like you to have health insurance, including the governor of this state of New Jersey. We need to make sure mayors, freeholders, assembly people, need to make sure you have the option. You don't have to do this. Nobody's twisting your arm to do it. But you need to know that it's out there. You need to know that there's an Affordable Care Act and you can get insurance. And I'm pledging the resources of the municipal government and all of our partners to make sure the residents of our city know their options between now and March 31st. We're going to be available. We're going to have counselors. We're going to have certified people that can walk you through the process, as well as the ability to meet with people on Tuesday, Wednesday, and Thursdays by appointment to go further. We could not do this alone. Union County College has been a big partner in this, and I'd like to introduce first the Assemblyman from the 20th District, who's been a big supporter of this act, Assemblyman Joe Crine.
Thank you, Mayor, and on behalf of Senator Lesniak and Simone Kenyano, we are here to also help carry the message, because it's important it gets out. I wanted to ask the folks in this room, if I can, show of hands, how many of you know someone who does not have health insurance? Show of hands. Look at all those hands go up. Look at that. How many of you know someone who has gone to the hospital in the last year, the emergency room, and did not have health insurance? Take a look. That's what we're up against, folks, and as the mayor has noted, the political winds are difficult. You actually may have seen something just the other day where there was a video where people didn't like ObamaCare, but liked the Affordable Health Care Act. Right? Some of you may have seen that. And the hyperbole that's out there is crazy. But this is about the hands that just went up. And you having the opportunity, thanks to the mayor's leadership, the City of Elizabeth, the partnership with Union County College, and I thank as well the folks in the Elizabeth City Library System, opening up and having the opportunity to do this. Having the opportunity for health insurance, for preventive care, is what we're supposed to be about. Here in New Jersey, we've seen that the market rates have actually come in lower than anticipated in terms of cost. So there are real opportunities for us here. And don't let anybody kid you, over the past couple of years, as we've seen the beginnings of Obamacare come in, we've seen lower costs in healthcare and the rising of healthcare premiums. There's a real opportunity here for you, for your friends, for your families. Help us. Help the mayor through his creative leadership here by spreading the word. Let everybody know. Call, sign up, get the right information from a certified professional, and together with health insurance, we'll have a better New Jersey for all. Mayor, thank you again for the opportunity. Thank you.
And for those students that are affected by the DREAM Act, keep in mind this is available to you. The Health Care Act can also get you insurance. You need to make sure that you have the ability to file and go on healthcare.gov. Now, the library director, she's brand new in the city of Elizabeth, so I've kind of thrown her into this, but she has stepped up. She has stepped up in a big way to say that we have resources in the library, we have computers, we can make sure that we have people that help the people at the library, and so I'd like to ask Mary Faye Shamil to come up and talk about her efforts, and not only the Elizabeth Public Library, but the branches as well, on how we're moving and teaching people about healthcare.
I'm very happy to be here. I believe in the Affordable Health Care Act, and I'm happy to say that at the Elizabeth Public Library, we have more than 100 terminals that are free to the public, internet terminals that you can use. You can come in and sign up. We also have, if you're not familiar with how to use the internet, we also have computer training classes that will help you get on board and how to navigate the web. But as the mayor says, we're going to also be having programs that the city will be sponsoring where you can sit down with a counselor and figure out what you need and how to get it for yourself. So our 100 terminals at our 4 locations throughout the city. You just have to come in and someone will help you get online. We also have free Wi-Fi. Some people are accessing the internet through their handheld devices. We have free Wi-Fi. You can access the Affordable Care Act through that if that's what you want to do. And if you need more information on what the library has to offer or you need more help, please just give us a call at 908-354-6060. And let's all stay healthy. Thank you.
All of these numbers are on our webpage too, as if you go to the City of Elizabeth webpage, you can find the numbers and they'll be updated. Keep in mind this is a process that's going to evolve, it's going to change, and the more knowledge that we get, the better off we're all going to be. I asked when the Affordable Care Act was going to be implemented on October 1st, I asked the Director of Health and Human Services to use her staff to help implement it and get trained and get her members to be very knowledgeable. So we have a focus point in the City of Elizabeth as well as an area in the City of Elizabeth where everyone can go to and that we can recommend. And I'd like to ask the Director of that department, Krishna Garland, to come up and talk about how she's worked with her personnel to train. And we'll have a little question and answers after this as well. Director Garland?
Good morning. So we have a sign-in sheet that's being passed around. Whoever has that, can you hold it up? sign-in sheet, there we go. So can we please get that sign-in sheet? We're asking everyone, please, to write your name, telephone number, and email address so that we can keep you posted with updates around what's happening with the latest information around the Affordable Care Act. So as everyone has heard, the enrollment for the Affordable Care Act has started as of October 1st, and the City of Elizabeth wants to encourage everyone who is in need of affordable health care, or if you're uninsured or paying enormous costs, then you can please explore this opportunity to enroll in affordable health care coverage. So, perhaps you have been denied health care, and as we sit here in October celebrating the survivors of breast cancer and remembering those who have passed away as a result of this terrible illness, we know that unfortunately there are many healthcare providers who deny you access to healthcare coverage once you've been diagnosed with an illness like cancer or a heart condition. And so here is an opportunity for those folks to get access to healthcare coverage. And so we say you cannot be denied now thanks to ObamaCare. So we're gonna say it that way. Someone said to me, can we not call it ObamaCare? And I said, no, we will, because it's a positive thing that our president has decided to make health care coverage available to those who have been denied. So thanks to ObamaCare, we are able to access health care coverage for those who have been denied in the past. Perhaps you are a college student who has been struggling with how will I pay health care coverage because I can no longer be on my parents' coverage. Well, thanks to ObamaCare, you are able to stay on health care coverage, your parents' health care coverage until age 26. So perhaps you are an independent contractor. So these are people like our truck drivers, our contract nurses, who pay enormous health care costs in order to be covered, or they end up not going to the doctor at all or running to the emergency room in the last minute. Well, now those folks are also able to apply for an affordable option for health care coverage. So from now until March, you are able to visit the website, which again is healthcare.gov, or you can call the 1-800 number, and you can get information by applying online or applying over the telephone. We've already talked about our partners who are making, like the library, who are making resources available if you don't have access to a computer. As we've talked about, our staff at the City of Elizabeth and in the health department are on an extensive waiting list to be approved as one of the providers to be able to assist. So I want you to know that when you come to the city and someone is assisting you with the services to sign up for the ObamaCare or the affordable coverage that's available, that you are getting trained assistance. And so the federal government has been really serious about making sure that everyone that provides information to the public is trained. And so we are therefore on the waiting list to be trained and have been in that process for some months now. So as soon as we are all trained, as soon as the staff is trained, we will make that information available to you and begin to schedule appointments at that time. So what you can do is call the office at 820-404-45. That's 908-820-4045. If you want to get on the waiting list to be given an appointment by the city employees, or the other thing that you can do is call directly to the 800 number and do it independently, and then you can call us if you have any problems or difficulties. You can also visit the city's Facebook page so that you can stay aware of what's going on, and the updates will be put on the Facebook page. And so we would like to thank all of you and all of our partners, and obviously we want to thank our great mayor for his leadership around this issue, and thank the college for having all of you here to get this information. So I think we'll be around for questions.
I also want to recognize a member of the City Council who's been extremely supportive of this as well, and that's Councilwoman at-Large Patricia Perkins-Auguste. Thank you, Councilwoman, for taking the time to join us here as well. Now, keep in mind, this process is going to be 4 months between now and March, or a little longer. And keep in mind that you need to access the web page or call us, but also note there's going to be people out there that are going to try and scam you. Let's realize that there are people out there who will use this Affordable Care Act, ObamaCare, in order to make money off of you. Do not, and tell your parents and your grandparents, and if there's a language issue, do not go anywhere but the websites or the City of Elizabeth in order to help you go through this process. There is no other way to do this. It's healthcare.gov or 820-4045 and work with our trained counselors. Or call my office if you have to, 820-4170. But keep in mind, if you get phone calls or you get solicitations that they can sign you up for the healthcare.gov by giving them money, then they are ripping you off. And there is no need to do that. This is available to everyone in the entire country, but you still have to do it. You still have to go on the web page. You still have to sign up to healthcare.gov, and it's got to come from you. So don't believe anybody, and please, some of you may have parents who are first generation and don't speak the language well or don't understand, and I don't mean that in a negative way, but tell them. Tell your uncles and aunts not to believe these phone calls. There's only two ways to do this. Healthcare.gov or call us to let you work through the healthcare.gov website. Now there's a lot of people, there were millions of people on healthcare.gov the first day. And there were millions more the second day. So the web page had difficulty dealing with all of the answers and the questions and the applications. But it's up until March 31st, 2014. There's going to be plenty of time to get everybody registered that wants to get insurance before January 1st. And the City of Elizabeth is plugging their resources to get it done. So if anybody has any questions on process, we're gladly going to answer them. If you don't mind, you state your name, yes?
I would like to ask you about, what about international students? They have to have?
International students. That's a really good question. Kristen? I don't know the answer, but if you give us your name and phone number, we'll call you with it. Okay? If you give it to Director, can somebody get a name and number? We'll check that out.
My name is Clifton Alexander, and I'm a certified navigator with the Urban League of Union County. And I just want to bring up one point that's important. Everybody is required to sign up for health insurance. That's part of the law. That's actually part of the negative part of the law. And there is a fine if you do not sign up for it. But there are exemptions. So if you can't afford it or you don't make enough money to afford the health care, which is actually relatively inexpensive, you will be fined unless you apply for an exemption.
Yeah, I want to thank Cliff and the Urban League, because the Urban League has been a great partner in this. And as we work through this process, the Urban League and Cliff and the other certified folks are going to be working alongside with us. So thank you for that, Cliff. And that's another part of the law, that everyone's going to have to indicate that they have health insurance at some point. That's not by March 31st, but that is, I think, January 1st of 2015.
January 1st is starting.
Yeah, so everybody's going to indicate that they have some type of health care policy. I'm going to guess international students are not qualified for this, but I will check it and get an answer to you.
I can answer that.
You can answer that, Cliff?
If they are U.S. citizens, they can qualify for health care. If they're not U.S. citizens, they do not qualify.
Well, my question is what kind of emergency care, like hurt or person has, what was that covered?
What kind of emergency care is covered?
So one of the things that you'll have to do as a part of the enrollment is shop for the plan that's most beneficial to you. So if emergency care is something that's important to you, then that's going to be one of the things that you really pay attention to when you visit the marketplace. So it's really about getting the healthcare coverage that's most beneficial. If emergency care is important to you, then you need to pay attention to that and what's being offered.
There's different levels on the website. Bronze,
Yeah, there's
silver, platinum, whatever they are, and gold. So you need to make sure whatever plan, that's why going on the website is important, find out what plan works for you.
And I know the mayor spoke about the different languages, and so one of the things that they are suggesting if you call in to the 800 number is that there are over 150 languages that is spoken. So whatever your language of comfort is, that you'll be able to get information in that language.
There's a question over here. Yes.
Yeah, I have a question in reference to, what if the insurance by January 1st, we haven't signed up?
Cliff, unless you know a different answer to this question, I believe that they have not advertised a deadline. They have just said that the sooner we can get the information and find out, the better. And that their
Open
system
enrollment is October 1st through December 31st.
for January 1.
For January 1.
Right. So they're obviously pushing for people to apply sooner than later, so not to wait, but at the same time, we do acknowledge that the system has been overwhelmed, and several people have had some challenges of getting online to the website.
I think that day's paper, I think I saw a date of, that's why I'm kind of confused, December 15th.
And that may be part, I mean, the sooner you, if you want coverage by January 1st, the sooner you get it done, the better.
Okay,
All right?
Thank you.
Yes.
American citizens who have the health care. What about the people who have green card in residence?
What about people, Cliff, what about people who have green cards or residents? You can answer that? Who are you, by the way?
I'm a Lisa. I'm certified.
Okay.
I did the health.
Well, use the microphone then, all right? Hold on.
Okay.
Say who you are so they know.
Hi, my name is Elisa Best, and I'm a broker for the healthcare. Okay, I'm a broker for the Federal Health Care Act, and I can answer a lot of your questions. Now, pertaining to that one question about someone with a resident card, okay, long as you have some type of status, you're eligible to apply.
Thank you. Next. Can you use the ObamaCare for secondary coverage? Cliff, Kristen?
No. Affordable Health Care Act is only for primary.
Primary care only. Primary care.
Sorry.
Good question. Yes, in the back, the gentleman in the back there with the baseball cap?
What about people that don't have jobs?
Yeah, that's the target. Go ahead, Kristen.
Well, so you know that this is a insurance where you pay, right? So this is a paid insurance. So there are income guidelines that are on the website that talk about what your income level is. So for example, for people who earn under $10,000, this is not an insurance that's designed for those who normally get Medicare or Medicaid or something insurance that's for low income. This is really an insurance that's targeting, the working folks, the middle class, the people who are going to file income taxes in the end to benefit from the tax credit. So that is really the target for this insurance. It doesn't mean that there aren't other things that are out there that target unemployed. That is not the primary target for this insurance.
So, wait for the microphone. Is Medicaid and Obamacare the same thing?
No.
No, it's not the same thing. It's totally different. Yes. That's a problem. I mean, this insurance is geared towards the working middle class and working lower class. If you're not employed, then you can't pay for the health insurance. So that's a segment of the population that's not targeted under this health care act.
Cliff, is there a time period for someone who uses employment and?
No, if you're unemployed, you cannot pay for it, and you can apply for the exemption. You don't have to worry about being fined or anything.
So it means that you don't get the fine
You will get fined
if
if
you
you
don't have
don't.
insurance.
Right.
So you need to go to one of the healthcare opportunities like charity care or something that is available for someone who doesn't have insurance.
You do need to go to the website and apply.
Wait, one at a time. Cliff?
I'm sorry. You do need to go to the website and apply for the exemption.
So I think that's one of the important things that I'm hearing is that it's important that people understand that there is a penalty that happens if you do not take the opportunity to get this mandatory insurance. So the way that this penalty, and people say, oh, I just won't pay it, but this penalty is going to come out of your tax refund. So it's not like you're gonna just not pay it. The federal government wants to make sure that you are hearing the message that they want people insured so that people are, being preventive in their medical care. Because if someone is without health insurance, we know traditionally what happens is that you have that pain or you have that discomfort, and we wait because I don't know how I'm going to pay for it, how am I going to pay for the medication, and so we put it off until it's a heart attack, or we put it off until it's something that's major that causes us to go to the emergency room and not have a plan for how that bill is going to be taken care of. And that is what we're trying to address through this kind of health care insurance.
Just for clarity, what I think I'm hearing the mayor say is that you should not pay someone to help you do this application because assistance is available for free.
Correct. There's no need to pay anybody for you to get through this process. Thank you. Any other questions? Yes.
What's up for the people, they still have insurance to on April, and this they have almost end of the year, 2014. You have the registration anyway?
So do you know what the next date is going to be that they open up enrollment?
Next open enrollment is October 1st, 2014.
So October 1st, 2014.
But there are special circumstances that you can apply for insurance. Let's say you have an addition to the family and you need to add that to the child to your insurance, you can just go ahead and add the child. If you lose insurance coverage for any reason, let's say you're working at for an employer, you get terminated or whatever, you need insurance, you could then go and apply for Affordable Care Act insurance under the market.
Good question. So the next open enrollment will be October. So if you have insurance that's going to take you through to April or May, then the next open enrollment will be October 1st, 2014. Good question.
So we've heard that Cliff has been answering a lot of our questions. So the Urban League is one of the groups, the Union County Urban League is one of the groups that's in the process of the training that I mentioned earlier. And so Cliff, you completed your training? Almost? Almost. So I shared with you all, it's a pretty intense training because they want to make sure people have the information. But I will give the Urban League's telephone number if anyone wants to write it down. It's 908-351-7200. And so as the mayor said, it's really important that you go to trusted resources. And I feel comfortable saying, and I imagine the mayor feels comfortable with me saying this, that the Urban League is a trusted resource in our community that you can reach out to.
I have my daughter, she's under my coverage, and
How old is
she's
she?
she's 25, but she goes to lab school. When she just turned 26, they like it's over for her, or
She has to then do it on her own. So I want to thank all of you for coming, and I thank all of you. And please spread the word about this. I mean, tell your friends and your family. We're going to be doing another one of these, maybe for seniors in other parts of the city between now and. Thanks for taking the time out of your day to join us here. Thank you for all the